You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I'm an holistic nutritionist and a professional cancer coach. What if aging didn't mean slowing down, losing energy, or accepting decline as your new normal? Today's guest is someone who is completely redefining what it means to grow older, and more importantly, how we can actually feel better, stronger, and more vibrant with time. Dr. Julianna Lindsey is board certified in internal medicine with advanced training in anti-aging and regenerative medicine, functional and integrative medicine, lifestyle medicine, hormone optimization, and peptide therapy. And what makes her perspective especially powerful is her experience inside large-scale healthcare systems, where she witnessed firsthand just how reactive and fragmented our approach to health has become. That experience led her to create Radiant Longevity, a clinic focused on personalized, proactive care, and to write her book, Radiant Longevity, A Physician's Protocol for Living Your Best Life. Today in our conversation, we are diving into what it really means to turn back the clock on aging, why your blood work may be telling a very incomplete story, and how simple daily habits from sleep and nutrition to mindset and movement can dramatically change how you feel and function at any stage of life. So if you've ever wondered how much control you actually have over your health as we age, this episode is really going to be helpful and quite an eye-opener for you. We'll be back in just a few minutes to talk with Dr. Lindsey.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back to the Health Hub. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub RMC on those locations. Dr. Lindsey, welcome to the show. Thank you so much for taking the time to be with us.
Thank you for having me back, Cathy.
We want to get to know you a bit before we start getting into the meat and potatoes of what you're working on. And you've worked inside healthcare systems, and now you run a personalized longevity clinic. What was the aha moment that made you say there's got to be a better way?
Well, there have been several over my career. I've spent most of my career, Cathy, in physician leadership, so helping other physicians be better physicians, help them do their job better, recognize how we can think better, make mistakes less often, avoid cognitive biases, and so on. In so doing, though, I've also had active practice myself, which I think is essential for a physician leader to also be seeing patients. It keeps you connected to your why and keeps you connected to the ethics of why you do what you do. So in my active practice, which has been in acute care medicine prior to opening this practice in 2021, actually it was in 2020, I saw so many cases either in the emergency department or in the intensive care unit where I was working, where doctors had just paid a little bit more attention, looked a little harder, a little deeper. If patients had known the right questions to ask, then they wouldn't be in such a critical, bad position that they were in when I was seeing them. And you could just roll that back and see how so much of what we take care of in acute care medicine is preventable.
Mm-hmm.
So it's just a matter of people not getting the right tests, not getting the right attention, then patients not knowing how to advocate for themselves. And we could prevent a lot of pain and suffering if we can, and we can do better. I mean, the technology's out there, the knowledge is out there, and we should be doing better. And finally, I just, at the end of 2019, I decided I'd spent 20 years in acute care medicine and trying to make medicine and healthcare on a really large scale in the United States better and safer for patients. And the Institute of Medicine report, their 20-year anniversary of To Err is Human, came out and stated that we have saved no more lives in hospitals 20 years later than we did in 1999 when that report came out, stating that a jumbo jet and a half of people, human beings, human lives, die every day in hospitals as a result of medical error. So I had a hard look at that and knew that I had spent 20 years doing the best I could, and I had risen through the ranks of medical leadership in the United States. And we were not doing any better despite all the quality measures, the check boxes, all the paperwork that was being done. It made no difference. So I decided that the best way I can make a difference is to engage with other human beings on a one-on-one basis and try and educate people and help people take care of themselves better, and also just give people the knowledge to advocate for themselves. Mm-hmm. So that is what I've done and what I continue to do.
Well, that's the impetus of this show, is to try and give people knowledge so that they have questions to ask, because I think that when you can supply people with questions and pathways to go down, that's how they become advocates for their own health. And I also think that in doing so, the medical profession, the doctor that is sitting in front of you, takes you a little bit more seriously when you have questions to ask, when you seem to have a bit of knowledge about your background. So I think it's a very important thing you do. Now, your book is called Radiant Longevity, A Physician's Protocol for Living Your Best Life. What do you mean by radiant longevity?
We want people to live their longest, best life. I think that most of us are not concerned about living additional years if those years are not high quality years where we're functioning at a high level. I don't think it interests anybody I know to spend the last 10 years of their life in a nursing home. To me, that's a nightmare. And I want to help people avoid that at all cost. And it's possible to extend your health span by just doing some very pretty basic things, but we need to do them with regularity, right? They need to become habits in our lives. And these are well proven ways that everyday people can take their health in their own hands, and it supports them in extending their health span and truly achieving radiant longevity.
Are we looking to actually turn back the clock on aging, or are we looking to age more in a healthful way? I think they're two different things.
I think they are too, Cathy, and I think that it's possible to do both. We will frequently see patients come into our practice and they're not in a good state of health. They've been receiving kind of your standard medical care that's available, but nobody's really gone that level or two or three deeper to find out what's metabolically ailing them, and started to fix those metabolic ailments. So I believe at the beginning, when people are metabolically unhealthy, that you can actually turn back the clock on aging. I think we can, I know we can give people better cellular health, and that's how you truly achieve longevity, is by that by creating cellular health in a very precise way based on each individual's risk factors, their genetics, how they live their life, the way they exercise, the things that they eat. All these things matter.
So to me, turning back the clock means that there's no you hit it now or you're going to miss it idea of trying to be healthy. You can, is it true that someone who has had an unhealthy experience can regroup and get to a better place under your protocols? And I mean someone who maybe have diabetes, someone who's gone through cancer. Do you offer hope to those people that you can add these steps or introduce these steps and also improve your health and longevity?
So, Kathy, the short answer is yes. Also, if someone is metabolically unwell, they are also going to they need to have the partnership of a physician who can help them become metabolically healthier. And let's take diabetes, for example. Diabetes, it has a lot to do with how you manage your life, your exercise, your diet. Most cases of diabetes it is also necessary to have some pharmacological intervention at some point. You might not always need pharmacological intervention medications for diabetes, but very often when people are metabolically unwell, particularly at the beginning of when we start taking care of them, pharmaceuticals are required to help get their metabolism turned around so that they can start to be healthier. But yes, it is possible. We've seen people who have come to us and even though they've been seeing physicians quite regularly and under regular medical care, they'll have had hemoglobin A1Cs between 6 and 7, and that gets you a diagnosis of diabetes when your hemoglobin A1C is in that range.
Mm-hmm. Which kind of brings us now to this space that you and I were talking about off air is blood work. When someone goes for their yearly checkup, everything can be fine. All the tests can be fine. However, they don't feel fine. I have heard that story so many times. Something, I just don't feel well. All my tests are coming back okay. But are we probing enough with the tests that we're doing?
I think in standard insurance-based care, Kathy, that the answer is no. I also believe part of the reason the answer is no, even if the quote correct tests were being checked, it's the idea of what a normal reference range is. So you may see something's in the green on let's say your LabCorp or Quest portal where you can look at your labs, but that may be so far out of range where a longevity physician might be looking at that we know that we have to help people optimize those numbers. And even though your normal reference ranges for, let's take vitamin D, for instance, start at 30 being a normal range. We consider 30 on your vitamin D level to be very deficient. We know that your body is suffering from vitamin D deficiency if your vitamin D level's at 30. Really, the basement that we like to see on that starts around 60.
Okay. Well, with the standard CBC, which is pretty much what you are tested for when you're doing your yearly physical, maybe cholesterol panels, things like that. What tests are we missing? What tests do you find are so indicative of health that we are missing the boat on by not using?
Well, I think that hemoglobin A1C is checked pretty regularly.
Mm-hmm.
Where we miss the boat there is not acting on those elevated numbers. And I've seen that time and again, people coming in from standard medical practice, and they may or may not have been told they have prediabetes. When your hemoglobin A1C is elevated above 5.5, you are not metabolically healthy. And there are steps that can be taken and should be taken to reverse that.
And then what about the imaging component of of our testing? Are there images that should be done on a regular basis, or just when there's a health crisis?
Well, we never want to wait till there's a crisis. I mean, that is completely backwards to let the horse out of the barn. And in almost every situation, you don't have to reach a crisis situation. There's always a preventative step that can and should have been taken. A lot of healthcare, as you know, Cathy, is determined by what insurance companies will pay for.
Mm-hmm.
For example, insurance companies will not routinely pay for a thyroid ultrasound. I see the reasoning based on population health studies, but in the past year, we've diagnosed 3 people with thyroid cancer through their thyroid ultrasounds that we do in office. These are not covered by insurance, but these people would have had that cancer growing in their thyroid gland for years before they knew about it. So we know that it's worth doing, and I recommend that most people, particularly women, although we've diagnosed a man with thyroid cancer this past year, get their thyroid screened. And if you'll let me just roll back just a bit to the blood work, Cathy, a very simple test that insurance will cover, and if they didn't, it only cost about $6 from your laboratory provider, is something called lipoprotein A. We call it LP little a. If you have LP little a, you are at much higher risk of developing plaque in your arteries. That should be known so that you can more aggressively manage your lipid profile and more aggressively get screened for heart disease. It's a cheap test. A lot of doctors don't know what to do with it, but they can read up on it and learn about it and learn what kind of risk that puts people at. But patients can advocate for themselves and ask for that LP little a blood test.
Okay. Now, the question that comes to my mind when we're talking about testing, and I want to get your opinion on it, is we're in our 20s, we get our blood work done. We get the standard, we'll talk about standard testing, standardized tests. We get the standard testing done, our numbers are here. In our 30s, we get the standard testing numbers done, and they may have moved a bit. And as we get older, these numbers shift. Is there a natural shift as we age, or is that something that's been sort of put in our heads and we should be fighting those trends? Medication as we get older, as you age, you're more likely to be on medication. This can change some of your numbers. Where do you stand when it comes to the leeway as we age for these numbers to shift?
To me, Cathy, and I think you bring up an excellent point. To me, that shifting in numbers with age is synonymous with decline. So our normal reference ranges for people are what their normal was in their 20s. So I don't find it acceptable that it's okay. It may be what usually happens, but it's not okay for your kidney function to decline, right? We need to watch people's high blood pressure, or even if it's not high blood pressure, we need to optimize people's blood pressure so that their kidney function does not decline. We need to make sure that they don't have diabetes that hasn't been diagnosed, and that's continuing to injure each organ system they have in your body, including your brain.
Mm-hmm.
So, no, we do not accept those age-related declines as a normal reference range.
Would this be the biggest blind spot you see that people have with their health right now, or is there some other area that you think people really need to be eyes wide open?
I think it is. I think it's a significant blind spot to really. I think, and a good place to start, Cathy, people getting standard medical care is to really sit down with your physician and dig into those numbers. Is this hemoglobin A1C? Tell me why it's okay for me to be at 5.6. Would it be better if I was lower? Tell tell me about my blood pressure. My blood pressure's been running high on the bottom number. It's been 85 to 90 for the past 2 years. I've heard that that is very bad for my health. Should we be doing something about that, and what should we be doing? Have you checked my vitamin D level? I've heard 30 is not okay. What are we doing about my vitamin D level being this low? And there are a number of things. Just if you can sit down and get more than 15 minutes with your physician, it could really pay off for you in the long term. Even just advocating for your blood pressure treatment. I see that a ton. People just letting their blood pressure be high and high and high. And that is so destructive to your kidneys, to your brain, to your heart. You know, people, if you're fortunate enough to live to be 70 or 80, you know, that turns into chronic kidney disease. That turns into heart failure with preserved ejection fraction, if you're lucky, or with reduced ejection fraction. But these, you know, blood pressure readings have real consequences over time. And we like to keep our patients under very tight blood pressure control because of those things.
Are you adverse to medications?
Absolutely not. There's only, where blood pressure is concerned in particular, there's only so much that you can do to help your blood pressure. A DASH diet is helpful, yes. It will reach its limitations. Not drinking alcohol is very important in controlling your blood pressure. But again, you'll reach a limit on that. Maintaining a normal weight and regular exercise, super important. A lot of people carry the genes for high blood pressure, and your blood pressure just is going to have a natural tendency to stay high. I'm an example of that. Both of my parents had high blood pressure. I am a very healthy weight. I exercise every day. I don't touch alcohol. I do all the right things. Eat a diet that's high in magnesium, potassium, calcium, etc. And I take blood pressure medicine every single day to keep my blood pressure down.
That's good to know, because I think we need to be integrative when it comes to these sort of things. And you know, I'm not a doctor, but the health of the heart seems to be something that is very doable in the medical space. The heart seems to have been tackled quite well when it comes to the medical ins and outs of taking care of it. But again, it's knowing when to ask the questions and getting the right tests done. Let's take a quick break here. When we come back, Doctor, we're going to start talking more in depth about your book and your protocols that you suggest for people to live a healthier life. Everyone will be back in just a few minutes.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back to the Health Hub. We're going to continue our conversation with Dr. Lindsey, and we're going to take a deep dive into her book, The Science of Radiant Longevity, the Radiant Longevity, the Physician's Protocol for Living Your Best Life. Dr. Lindsey, can you walk us through the Lindsey protocol, like the 8 essential daily steps? I think it's 8 of them, right?
Yes, ma'am. Yes. Thank you, Cathy. So I like to start my day on a positive note, and I would say all eight of these items are achievable for people. Don't try to do all 8 at once. We can normally make 1 to 2 changes at a time. Once you have one change kind of ingrained, then put on a second one of these items. And if it's something that can build on the first one, it's going to be even easier to stack. So the first thing I do in the morning is I try to get out and get sunlight in my eyes early. So that gets me outside, gets me in nature, gets sunlight in my eyes, and it's important not to wear sunglasses or glasses, and looking out a window, unfortunately, doesn't count because you need that full spectrum sunlight. The next thing you could build on is starting to count your steps. So one of the other items in my 8 steps of the protocol is to move your body by getting at least 7,500 steps a day. You don't have to get 7,500 in the morning, but you can start your day with a little walk outside, and that will start getting your step count up. The third thing is, and it's easy to put into this getting outside habit, is to start your day with gratitude. So I like to begin my day by recounting at least 3 things for which I'm grateful. And that's very easy to do on a daily basis. We have so much to be grateful for, all of us. Even when we're going through a hard time, we can typically find something to be grateful for, even if it's the fact that we're able to walk, we're able to breathe, we're able to see. Hopefully we have people who love us and who we love. And that brings me to the fourth item, which is fostering human connection. So we want to stay connected to others, friends, family, but having those meaningful relationships with other human beings is good for our soul. And if it's good for our soul, it's good for our health. Another item on here, which is not too hard to include in your daily regimen, is to eat a serving of greens every day. We know that people who eat a serving of leafy green vegetables every day live a few years longer, and it also seems to be protective against cognitive decline. So I try to eat my greens in every day. Another item on the list is to include nuts in your daily diet. So the way I include nuts in my daily diet is to have them at breakfast. I take supplements every morning, and I just have a handful of nuts with my supplements.
Peanut butter work? Is that considered a nut?
Peanut butter?
Mm-hmm.
Oh, absolutely. Peanut butter counts.
Nut butters?
Yes, ma'am. And a lot of times I will use peanut butter as my nut that morning. Absolutely. Yeah, tree nuts or ground nuts count.
Excellent.
Yeah, great question. Another item on the list, and I think this would be number 7, is to prioritize high quality protein. I think and that's really gotten a lot of attention in social media lately. So we're probably pretty aware of the protein business. But I like to get a gram per pound of lean body weight is the protein goal that we typically help people set for themselves.
So you're on a bit of the higher end, a gram per pound.
Yes.
Okay. Because, I'm starting to see people push back about the high protein diets. So it's interesting to see everybody's, the spectrum of thought that different areas of medicine has.
Well, and probably not everyone needs that level of protein, Cathy, but I lift weights. I do resistance training very seriously, and other sports that require muscle strength. So for me, I need that level of protein.
Mm-hmm. Okay.
We promote resistance training for our patients. So most of our patients are doing serious resistance training. They don't have to do necessarily bodybuilding, but we want them to be having a lot of muscle mass and healthy muscle mass and muscle function. That is very important for longevity, and protein's part of that.
Yeah. Okay.
And then the 8th thing on our protocol that we recommend people do is to track your sleep. Sleep is such a foundational point of health, of overall health and longevity. You know how you feel if you get a poor night's sleep. You're just, sometimes I'm just not much good to myself or anybody else with a poor night's sleep.
Mm-hmm.
And if you have sleep issues, then you really want to try to get on top of that. But the first way to know if you're having sleep problems is to track your sleep. We find that patients often believe they're getting a higher quantity of sleep than they actually are when they start tracking their sleep.
I think that sleep does change as we age. It's one of those things, I don't know why. But I mean, I've had trouble sleeping myself the last couple of years where I was a great sleeper. And I hear it so many different spaces. When it comes to sleep, all these other things is just you do it or you don't do it. When it comes to sleep, it can be very challenging because you can do all the right things, take the breaths, sleep in the cold rooms, in the dark room, but it still doesn't do the trick. Do you use supplements for sleep? Do you recommend supplements for sleep? Do you have any tricks that we haven't heard of?
Kathy, I agree with you that sleep does change with advancing birthdays. I think that is a fact. What we help people with is first of all track your sleep so we know what's going on. Are you are you having trouble falling asleep? Is it trouble staying awake? Are you waking up a bunch of times? When you wake up, can you not go back to sleep? So we try to drill down and identify a potential root cause for their sleep problems. Sometimes that is because of hormonal imbalances. I'm thinking about sex hormone imbalances in particular. As women age, we have declines in our sex hormones, estrogen, progesterone, and testosterone. If those levels aren't optimized, then you can absolutely have difficulty with sleep. And we never want our patients to go through a period of estrogen deprivation. So a lot of times that sleep problem is going to be the first thing that presents itself and lets us know that we need to go further into their hormone testing. Another hormone that men and women can get imbalanced is cortisol.
Mm-hmm.
Sometimes when people are in periods of excessive stress, or if they've been under stress for a long time and their adrenal glands just kind of get out of balance, their cortisol levels will actually be higher at night and lower in the daytime. So that can cause for sure, sleep disruption. And then when we figure that out, then we can help them address their cortisol levels. So make sure you don't have something metabolic going on before that it's going undiagnosed.
Are you a big proponent of bioidentical hormones?
Oh, huge. It's an essential part of aging well.
Okay, and what about peptide therapies? What role do peptides play in longevity?
Well, that is a really broad topic and one that's getting a lot of attention in social media. So really glad you brought it up. So I've done a full fellowship in peptide therapy. It's a ton of training, and I can tell you that not all peptides that are out there being hawked on social media are safe. Not all of them are effective. If you can find a physician who knows what they're doing in the peptide space, I would highly recommend you have at least a consultation with that person. Some of the peptides that are out there can actually cause cancer. So I'm not saying they're all bad. We use peptides a fair amount in our practice. Some of these peptides are highly useful. I will say, Cathy, I have not found that some of the sleep peptides are very helpful, like the BSIP, the deep sleep inducing peptide. I haven't found good clinical results with that, unfortunately. The peptides that I think are most important and most highly contributing to longevity are the GLP-1s. So the
Interesting.
injectable semaglutide and tirzepatide.
And they
These,
come with their own set of side effects as we're starting to see more and more, correct?
yes,
So
they
they
can.
have to be used in the correct space.
They absolutely do, and under the correct guidance, it it is heartbreaking to see people using these peptides that they've gotten online. They're injecting themselves. They feel great about losing a bunch of weight, but what they've lost is so much muscle mass, and they're unhealthy, malnourished. They haven't maintained their protein intake. Those peptides change the way your body interacts with food. So they change like your how you your cravings, right?
Mhm.
So because they slow down your digestive system, you're gonna want to not eat as much protein. You're gonna want simple carbohydrates because it's not gonna give you as much reflux. So if you are using those peptides, I hope that people are under the care of a physician who is knowledgeable in this area and keep them on the lowest effective dose and help them mitigate the side effects of these peptides. They can be powerfully positive for health. But like I always say, anything that can be powerfully positive for your health could also have a powerfully negative effect under the right circumstance.
Okay.
We do
And
use a lot of peptides.
sorry, I cut you off there.
Oh, we do use a lot of peptides. The GLP-1s are the ones that we use the most.
Okay.
I am a fan of BPC 157, particularly the oral BPC 157. I don't think that it is currently legal to use the injectable. Thymosin alpha 1 is a peptide that we use a lot. That peptide has a lot of very positive pleiotropic effects in the body. We use that for a lot of different things. We use kisspeptin a fair amount. And then I'm starting to use oxytocin more.
Okay. Good to know.
PT1 can be helpful too.
So the overriding message here, other than the value of peptides, is that they should be under doctor's care, 100%. Important message. Now, when it comes to diet, you mentioned a few things. Do you think that we can maintain an adequate, healthy diet without supplementation? And if not, what are the supplements that you recommend using on a general level?
Great question. I find it personally very difficult to tick all the boxes on my diet every day because I'm just a busy person. I grow my own vegetables. I can't supply 100% of my vegetables through my garden, but I test my soil so that I know the nutrient levels in there are right. Our soil quality in the United States has suffered over the past 50 years tremendously.
Mm-hmm.
So a tomato today does not have the same nutritional value that a tomato did 30 years ago. I think it becomes increasingly challenging for us to get all of the nutrients that we need through a diet. I wish that was possible. That is the best way to get it. Still recommend people have a highly varied diet. You shouldn't be eating the same thing every day. Eat different fruits and vegetables. We can eat them from different parts of the world now. So we can get things like dragon fruit that we can put into our diet that was once not even possible. I think most people are going to need some supplementation. We check blood work and levels to know what people are deficient in, but we also do dietary surveys. So one of the things, Cathy, that I think is prevalent in the United States is a low choline diet. Choline is present in organ meats, which are no longer a regular part of the American diet, and eggs. They're present in other foods as well, but to a much lower extent. Organ meats and eggs are going to be your primary sources of choline. Why is choline important? Choline is important for people who have methylation defects. If they don't methylate and they need particular B vitamins, that helps in that particular process. So if you've been told that you have an MTHFR problem, you need more choline in your diet. Choline is important for our brain and nervous system function. It's necessary to maintain healthy cell walls, particularly in our central nervous system. But also on the cancer front, a low choline diet is associated with a significantly higher incidence of breast cancer. So for our patients who have higher breast cancer risk, and again, we know the genetics of our patients, so we're able to speak to this. But even if you don't know your genetics, you know your family history, which is a good indicator. People who have a higher risk for breast cancer, if they're not eating an egg or eating organ meats regularly, and I mean on a daily basis, we put them on a phosphatidylcholine supplement.
That's good to know. Moving on to, we've talked about exercise a bit. The one thing I wanted to touch on, again, as we are aging, does exercise look different? Do we need to slow down? Do we need to take more rest days? How do you manage a 30-year-old versus a 60-year-old?
Well, that is a highly individualized response.
Okay.
I think it doesn't have to be. I think when people expect decline, that you're going to get decline. That being said, there are some real physical things that can happen to the body that may change the way you exercise. Arthritis being one of them. So I quit running 2 or 3 years ago because of the arthritis in my knees. When I was in medical school, I would run 6 to 10 miles most days of the week, and I just kind of destroyed my knees. I think people can build up their exercise tolerance and intensity. Obviously, you need to be careful about screening for heart disease. You don't want to start, doing HIIT protocols if you have not exercised. There is a way to progress yourself into exercise. But the exercise, now I'm the oldest person in my aerial community, I think, that does this sport. But my main sport that I picked up just over a year ago now has been aerial dance. You may be familiar with the hanging. It looks like a hula hoop. It's called a lyre.
Mm-hmm. Yes.
The silks, the 2 silks that hang from the ceiling, and you do acrobatics in the air. So I picked up that sport just over a year ago, and I do that 4 or 5 days a week. And I see little reason why other people who are in their 40s, 50s, or even 60s shouldn't be able to pick up something of that magnitude. You just have to do it the right way if it interests you.
Mm-hmm.
But I think most of the limitations, Cathy, that we put on we put on ourselves.
Okay. And it's more of a listen to your body sort of thing and do things smart.
Absolutely.
And take in rest days. I think rest days are important for a lot of us. And I wanted to end on one thing that people may not kind of associate with good health is the look of our skin and how we can show aging externally. What do you feel can really impact our outward appearance, what our health can actually reflect in our skin?
So healthy, vibrant looking skin starts on the inside. So it starts with a good diet. It starts with having your vitamin levels in the right place. A diet that's high in beta carotenes gives your skin a certain tone and glow that is very positive. Having enough protein and collagen in your diet helps to fight the fine lines and wrinkles. Having enough estrogen for women is super important for your skin tone and quality. I can frequently tell if a lady I know my patients very intimately. So if I see them developing some fine lines, even if they haven't reported sleep disruptions, mood disruptions, or other indications that they might be going into perimenopause, then you can often detect a change in texture of their skin. That leads me to check more deeply into their hormone levels. So maintaining a good healthy level of estrogen in your body for women is important for your skin tone. The other thing I recommend for our patients across the board is tretinoin. So Retin-A is different than retinols. Retin-A being tretinoin, it actually helps build the structure of your skin. It makes your epidermis thicker, which leads to fewer fine lines and wrinkles. When used regularly, it can also decrease your risk of skin cancer in the areas where you're using the tretinoin. So that's a very good move for patients to get on tretinoin for their skin.
Wonderful. Thank you for that. Your book, as I mentioned earlier, is called Radiant Longevity, a Physician's Protocol for Living Your Best Life. Where can we find it? And can you give us contact information or social media handles?
You bet, Cathy. So Radiant Longevity is available from high-quality booksellers. You can get it off Amazon, Barnes & Noble, wherever you're buying your books. You can also reach out to us at radiantlongevity.com. And our website is not terribly robust. That is for a reason.
You were working on a book.
But I'd respond to the contact form.
And social media handles, are you on social media at all? You play around there?
Yeah, some, not much. It's under Radiant Longevity.
Wonderful. Thank you so much for joining us today. It's been a real pleasure and very informative, Dr. Lindsey, and good luck with the book.
Thank you, Cathy. It's always a pleasure speaking with you.
Thank you. Everybody, we'll talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Cathy Biase, here on Radio Maria Canada.